Healthy Lifestyle Crib presents 10 early signs of diabetes you shouldn't ignore. Symptoms of high blood sugar might appear gradually and unnoticed. Type 2 diabetes hallmark symptoms, such as frequent urination and increased thirst, are frequently modest and readily attributed to other sources. In fact, until they are diagnosed with type 2 diabetes, the majority of patients with diabetes are completely unaware of their condition. Diabetes is a long-term disease characterized by abnormally high blood glucose levels. To ignore or brush off symptoms as anything else can lead to more serious health concerns in the future. When diabetes isn't managed properly, it can lead to a variety of health problems, such as heart disease, stroke, neuropathy, kidney damage, and even blindness. Your organs can be damaged even if your blood sugar levels are only slightly elevated. Diabetes affects a large number of people. Diabetic prevalence is estimated to be 34 million in the United States, with 95% of those cases being type 2 diabetes. 88 million persons are considered pre-diabetic. When it comes to diabetes, Summa Health has compiled 10 early warning symptoms of the disease. Even if your symptoms are minor, you should tell your doctor about them. Especially if you're at risk for developing type 2 diabetes. The longer you go without therapy for high blood sugar, the more damage that can be done. Number 1. High blood sugar can be detected by frequent urine, particularly at night. The kidneys have to work harder to eliminate extra sugar from the blood because of diabetes. You'll urinate more frequently if your kidneys can't keep up with the demand. Number 2. The extra sugar in your urine feeds yeast and bacteria, causing recurrences of infection. Food and a warm, moist environment are essential for their survival. As a result, many patients with diabetes, particularly women, suffer from recurrent yeast infections or infections of the urinary system. Number 3. When you pee frequently, your body loses a lot of water, which causes you to feel thirsty more often. However, consuming additional water would not quench your thirst. Number 4. Your body transforms the food you eat into glucose, which your cells use as a source of fuel. Diabetes, on the other hand, prevents the cells in your body from properly absorbing glucose, resulting in a lack of energy from the food you consume. Consequently, you'll feel hungry all the time, even if you've recently eaten. Number 5. Unexplained weight loss. Your body will start burning muscle and fat stores instead if it can't receive enough energy from your food. So, even if your diet hasn't changed, you can still lose weight. Number 6. Energy depletion leaves you with a constant feeling of exhaustion that might make it difficult to carry out your regular tasks. As a result of the continuous urinating, you may also feel weary. Number 7. Blood vessels in the eyes might become damaged due to high blood sugar, resulting in hazy vision in one or both eyes. In the absence of treatment, long-term damage might ensue and even lead to blindness. Number 8. Damage to blood vessels can slow the healing of cuts and wounds caused by high blood sugar. Cuts and wounds don't heal properly if they don't receive the appropriate nutrition and oxygen. Since it can take weeks or even months to recover, this can lead to an increased risk of infection. Number 9. Hand and foot tingling, numbness, and discomfort are all symptoms of poor blood circulation and nerve injury. Number 10. Diabetes can result in dark, velvety patches of skin in the folds of your neck, armpits, or groin as a result of an overabundance of insulin in the blood. In order to avoid difficulties, it is important to get regular testing. You should see your doctor periodically for checkups and diabetes screenings because the symptoms of diabetes might be difficult to detect. Diabetic screening is recommended for those 45 years and older. However, if you have one or more risk factors for diabetes, testing should be done at any age. A simple blood test is often all that is needed to diagnose diabetes. A repeat screening every 3 years is recommended for healthy individuals. Type 2 diabetes can be easily controlled if diagnosed early. A healthy diet and regular exercise can make a big difference in how well you manage your illness. Make an appointment with your doctor as soon as possible if you notice any changes in your health. Early detection and treatment are critical for enhancing your well-being and minimizing your likelihood of developing life-threatening side effects. If you want some tips that can help you get back on track to control diabetes, or even pre-diabetes, you can check out this video that Type 2 diabetes and pre-diabetes can be managed, or possibly reversed, if you know how. Click the link is in the description below. If you enjoyed this, make sure to subscribe and turn on the notification bell to receive new videos as soon as they are posted. Also, don't forget to watch our other videos. Many thanks for taking the time to check it out.